On most summer days, this is where you'll find Tammy Rieger. She loves tending to her flowers and plants at her and her husband Don's Milbank, South Dakota home. Years ago, it was like any other summer day. Tammy was out watering her flowers and plants when she noticed a sharp pain in her leg.
And I felt like I had pulled a groin muscle. And so I treated it that way for most of June.
She didn't find any relief. In July, she made an appointment with her primary care provider and started physical therapy.
And about a week after that, I work at the school, so I was just coming off summer break. We were setting up some tables, and I got a severe leg cramp, and I could not get it to go away.
Her husband Don urged her to go back to the clinic.
We did an ultrasound, could not get a conclusive answer, but they could see something. Did an MRI, same thing. Referred me then for a biopsy.
Tammy was told she had extraskeletal myxoid chondrosarcoma, a very rare type of muscular cancer. Dr. Joshua Johnson, an orthopedic surgeon and orthopedic oncologist at Sanford Health in Sioux Falls, said the bigger the size of sarcoma, the higher risk for growth and spread.
It was probably about the size of an orange. Typically, treatment for soft tissue sarcomas is a combination of radiation and surgery to remove it.
He said doing radiation before surgery means a smaller dose of radiation for the patient.
If it's after, they sort of have to guess where the tumor was and where we were during the surgery, so they use a larger dose over a larger field.
Tammy's treatment plan was radiation 5 days a week for a month.
And then we let their skin rest for a couple weeks, and then we do surgery to remove the tumor.
She's now in what's called the surveillance portion of her treatment.
So we're watching to see, is the tumor coming back? And so we're doing an MRI of the area and then a CT scan of her chest, because the most common place for sarcoma to spread is to the lungs. And so the highest risk for it coming back is in the first 2 years.
They're 3 years out from surgery. Tammy and Don come to Sioux Falls every 4 to 6 months for imaging. There's currently no evidence of disease on her scans.
Most people, again, here in the States would follow a sarcoma patient for about 10 years or so. After that, the likelihood of it coming back is so exceedingly low that we basically say you're cancer-free.
Today, Tammy is back to tending flowers and enjoying warm days on the deck with Don. They're both counting down the days until retirement. She said it's important to have a relationship with a primary care provider.
You have to listen to what your body is telling you, and you go to those care providers that have that knowledge, or they know where to get you to the next step, which for me was Dr. Johnson. So fortunate that we had an orthopedic oncologist here.
In Milbank, Simon Floss, Sanford Health News.